Want to know how to treat a SVT, tachycardia? Check this video out. I got you. Hey guys, in this video I'm going to explain to you how to treat SVT, tachycardia in a patient that is stable SVT and unstable SVT. But before I do that, I want you to make sure that you remember that you're supposed to treat the patient, not the monitor. So if you put a patient on this monitor and you see the SVT is at 200, but yet the person shows no signs of symptoms, make sure to troubleshoot your monitor and make sure that it's accurate before going ahead and implementing all these things. Once you make sure that the patient is correlating and is synchronized with the monitor, and they need to be treated, then I would proceed as following. First and foremost, I will determine the etiology, which is the cause of the SVT. So is the SVT due to too much caffeine? Is it due to stress? Is it due to the consumption of illicit drugs? You want to find out the cause. All right. Now, after you find out the cause, that's going to determine how you move forward. But moving forward, and let's suppose that the cause is just cardiac related, then the SVT, I would start off from BLS to ALS. Remember, I always tell you guys, basic life support should be executed or rendered prior to advanced life support. So after confirming the cause, after making sure that the SVT is real by checking the monitor and making sure that the pulse rate matches the monitor and the patient's presentation, I'll put them on oxygen depending on their pulse ox. And the next thing I do is I instruct them to close their eyes and meditate. Close your eyes and take really deep breaths. It's not a meditation session, but it helps them relax while we start setting all this up. If that doesn't work, I ask them to do the Valsalva maneuver. What is the Valsalva maneuver? The Valsalva maneuver is when you ask a patient to bear down. Another thing you can do is you could take the plunger out and have the patient blow in through this side really hard and put their hand here. So it helps and is similar to the Valsalva maneuver. I'll make a video eventually demonstrating that for you. The next thing I would do is start an IV, and here again I have my best friend, the 22 gauge. Don't be afraid to use the 22 gauge, especially for this instance where you're not going to be giving a bunch of fluids. It's best to have a 22 gauge than no gauge. Obviously, if you get 18 gauge, then go right ahead, but if the person has bad vasculature, use that. Now, as far as the treatment, you see the spikes all over the screen, and now it's time to treat this patient. Let's say their pulse rate is over 150 beats per minute and they're stable, then I would proceed like this. First, after establishing the IV, doing the meditation and the Valsalva maneuver, that's not working, they're on oxygen, that's still not working, I would then go ahead and give, I'm trying to make a zoom but it's not zooming, adenosine, right? The dosage for this is 6, 12, and 12. Rapid push. I don't mind starting IVs on a patient's hand, but in this case, ideally you would start it as close to the heart as possible. So the AC is a good place to do it because it's closer to the heart. Guys, a quick word about diltiazem and adenosine. These medications pretty much are not identical but have a similar mechanism of action. Long story short, these both could decrease chronotropy and dromotropy, which in essence will cause smooth muscle relaxation and coronary vasodilation. So basically, the chronotropy is affected via the SA node, and the dromotropy is affected by the decrease in calcium, which decreases the contractile force. Again, these medications are not identical, but they have a similar effect via the previously mentioned. Now, real quick, if you have a patient in SVT, you see a heart rate over 150 here, and the person's also suffering from something else like chest pain, do a 12 lead. And I had an instance where the patient had SVT at a rate of 180 along with a myocardial infarction. When the SVT is because of something else, what I do is I lean on online medical control to see how they want us to proceed. Are we treating the myocardial infarction, or am I giving adenosine to treat this patient? And what I found is that when SVT is, I guess, coming along with another patient presentation, like in my case, the myocardial infarction, heart attack, the doctor always has you focus on the heart attack as opposed to the SVT. That's why at the beginning of this video I said find out the etiology, find out what's causing it. And the way I would handle SVT being caused by another medical issue is I would call online medical control for direction if it's not obvious that or what you should do for treatment. Never be shy and afraid of leaning on online medical control for guidance. So you got the stable patient, you did all this other stuff, right? Remember, another tip is if you're gonna flush something, it's good to flush it with a 10 cc flush, or you could use it and just do the medication straight through here and flush it through the saline with a 10 drop set. Because again, this has a very short, the adenosine has a very short half-life. You want to inject it straight or as close to the heart as possible via the intravenous access and do a rapid flush, right? If that doesn't work, you call online medical control, and you call online medical control for diltiazem, 0.25 milligrams per kilogram, slowly. If the blood pressure is normal. If the blood pressure is not normal, and the patient's unstable, then you could go ahead and bypass these things or do that simultaneously as you cardiovert. How do you cardiovert? Pretty simple. Turn the monitor on, make sure it works. It's pretty user friendly. Press this right here, test passed. Press this right here, notice the sync is on. Press energy select, and you could go ahead and toggle through, making sure that you choose the energy that's necessary. And after you shock once, it'll have it right here. So in New York City, the first shock is 100, 200, 300, and 360. In this monitor, notice that it goes up to 2, so that's as high as we're gonna go. We'll just keep shocking them at 200. All right. The next thing you want to do is, after doing that, or before doing that, if the patient's conscious, then you pop these babies right here and provide pre-hospital sedation for the cardioversion. Now, once again, start with BLS maneuvers, put the patient on oxygen, treat the patient, not the monitor, put the electrodes on. Obviously, I didn't mention it, but just in case, put the pads on, then play with the monitor. Before cardioverting, put the person on oxygen. If you're gonna flush it, this is a good way to flush it with a 10 drop set. If you're gonna give the amiodarone is 150 milligrams in a 100 cc bag of D5W over 10 minutes. This is another option that is on online medical control. And let me see if I'm forgetting anything. Nope, that's about it. All right, guys, I hope this helps. If you have any questions, comment down below. I got you. Peace.